Hello, this is Kyle Matthews of the Montreal Institute for Genocide and Human Rights Studies. We're here for another interview as part of our Coronavirus Diaries, discussions about human rights in the age of the global pandemic. Today, I'm very fortunate to be joined by Dr. Ilhan Kizilhan. He's a professor of mental health and trauma. He's the dean of the Institute of Psychotherapy and Psychotraumatology at the University of Duhok. He's also associated with the university in Germany. He's also director of the Institute of Genocide and Peace Studies. Jan, great to have you with us today.
Thank you for the invitation.
So I really would like to talk to you today primarily about what's happening in Northern Iraq and the case of the Yazidi community. Many Canadians, people working in human rights around the world know about what happened to the Yazidis, how they were attacked by predominantly the group ISIS, how there was enormous trauma caused by sexual violence, human trafficking, and genocide. But I wonder if you could tell us, what are the case of the Yazidis today? What is their situation in Northern Iraq?
Actually, the situation has not been changed very much in Kurdistan or Northern Iraq. Still, there are about more than 300,000 Yazidis in refugee camps around the province of Duhok. We have still 100 to 160,000 Yazidis who are living in the area in Sinjar, where is a homeland of the Yazidis, which is time by time attacked by the IS. And the last 2 weeks, many of them, again, some Yazidis were killed by IS attacks. So still there is a problem of security. And we have different kind of groups who are not able to find a perspective for the Yazidis. So the situation in general for the Yazidis in Iraq is still not clear. They have no any rights for just have a province or just want to be able to go back in Sinjar. But after the coronavirus, the situation came really very bad because in the area of Sinjar there are not any medical staff or hospitals. Most of the NGOs withdrew from because of the coronavirus crisis, and even in the refugee camps, they are living in 22 different refugee camps. One is maybe 110,000. The biggest of the refugee camps of Khaneke have about 28,000 people who are Yazidis who are living there. So my concern actually is if the pandemic, the coronavirus is starting in the refugee camps, we will not able to stop this. Just to hand washing, you have to imagine in one tent, maybe 10 or 12 people are living together in one small tent, and one tent beside one tent. So if one is infected by them, you will be not able to stop. And we don't have any medical staff or any hospitals who are able to support them or to take care and to take care of them. So far, from this time, it's very important to do everything regarding prevention. To inform those people how to react. And we did last week a research which will be published the next, and it shows that before the COVID-19, the level of traumatization was by women and male about 30 to 40%. Now we did a research and compared this during this crisis, it's a rise about 20%. So most of them have about 50 to 60% of post-traumatic stress disorder, especially in case of anxiety and worriness. It's a rise very high because they say we don't know what we can do if the epidemic or the coronavirus will start there. So we have to prevent in case of giving a lot of information. So I started in the last 3 weeks with my students to do some, like you, to do some video clips in Kurdish in the language they can understand, to give them basic information. What is depression? What is PTSD? How you can organize somehow your everyday lives, how you can deal with children because they're all the day in the tent on the refugee camps or in Sinjar in the houses. So to give him basic information and give him some support. In the beginning of next week, we will have an online portal in Kurdish with video clips, and they can ask us questions, and we will try to answer the question on the time of 24 hours. But this is small help, but maybe we can do everything to prevent, hopefully there will be no any cases.
So you mentioned one thing that I think is very important. You said that the difficulty of the refugees in these camps, that they live very close together. So it's very difficult for self-isolation. I imagine there's also difficulty in finding enough water to wash and keep your hands, challenges of food security. So there really is a design issue with the camps that have to be improved, but also with no healthcare, there's also an urgent need. What should the international community be trying to do to help the Yazidis right now?
I mean, this is actually just not a case of the Iraqi government or the Kurdish government. It's a case, the emergency case of the WHO, the World Health Organization, and they have to act very immediately, and they have to act today and not tomorrow. Otherwise, we will have a catastrophe, because the governments are not able to handle this in Iraq. In Kurdistan, the situation is more or less as good as it looks like it's under control, but we are not sure if it will happen this tomorrow, the next days and next weeks.
So Jan, you also said that there's a lack of healthcare infrastructure in the area where the Yazidis are. I'm wondering, is there a lack of healthcare infrastructure? Was it destroyed by ISIS, or is there also just a lack of interest by the central authorities? What explains this lack of medical infrastructure?
You know, I'm working since 2014 in Iraq, and I'm a dean of the institute at the University of Duhok. And during this IS attack, many doctors and physicians left Iraq, for example. Just in the province of Duhok, in the last 2 years, 200 physicians left Iraq, came to Europe, America, and other countries. So we don't have enough medical care and medical staff. We don't have enough hospitals, and this must be supported by the international community. Otherwise, they will be not able with coronavirus to handle this issue.
Okay, so international assistance is key, and one of the challenges right now is that, as you know, traditional countries that support the UN, we've seen our economies kind of shrink. We have economic collapse, so there's a real danger that Western countries will look inward and will not provide as much foreign aid. But right now, the needs are larger than ever before. So it's really important that I think that we have to communicate this to political leaders and to everyday citizens.
Yeah, it started with to send more medication to support these people. Still, we don't have enough medication in Iraq and in Kurdistan, and to educate and train them. Maybe we can also train some doctors. I know it is not realistic to take much doctors to Iraq because we have their own problems in Europe, Canada, or America. But at the same time, we have to set up a program with a short and long term to support the people in Kurdistan, especially Yazidi people.
So maybe my last question for you, Jan. Right now, it's difficult. You said it's difficult to send doctors because borders are closed. The international airline industry is kind of frozen right now. But what are the local NGOs that are operating in this part of Iraq that could actually use support that should be on our we should know about and try to see if we can support from afar?
First, I believe the international community like UN or World Health Organization should send immediately supplies, disinfections, possibility to hand washing, and have enough distancing to send or develop information in the language that the people can understand for prevention, and in the same time be in contact with the Iraqi and Kurdish government. You know, somehow we can also train through online many doctors and give some advices how to deal in some crisis. And that will be also hopefully, and the next start can be to support with the psychosocial support for the short time via online, via internet, that people, if they have some anxiety, trauma, to be able to get through experts and psychotherapists some help and support, and maybe they can be a little bit relaxed and be able to organize their everyday life without any sleeping disorder, anxiety, and worriness about himself and his family.
Well, Jan, I want to really thank you for taking time today to talk to us about the case of the Yazidis and the threat of coronavirus. And I wish you best of luck in your important work that you're doing to help them.
Thank you very much. Thank you much for the interview. I appreciate it really. Thank you.